Lisa from Cosmetic Medicine, and I'm one of the nurse injectors here. And today I'd like to talk to you about skin needling. Whenever we're doing Botox filler treatments, etc., they always work better if people's skin is in good condition. So one of the ways to do that is through good skincare, but also through collagen stimulating type of treatments. Dermotherapies, and one of those is skin needling. Now, skin needling sounds a bit scary, doesn't it? Needles in the skin, but they are very tiny little fine needles that we use. They are only millimetres long, and they only penetrate the very epidermis of the skin. Now, the old type of skin needling that you may have seen used to use a roller, and it was rolled across the skin backwards and forwards, and because of the way it was done, it was quite painful. So people would need local anaesthetic on for quite a long time. It was also quite messy, so it used to cause bleeding because you couldn't control the depth of how deep the roll went in. So people would end up pretty red, looking a bit beaten up, and could often get quite a bit of bruising afterwards. Luckily now though, we have much better techniques of doing needling. So we have two types of needling available here at Germ. We have one which is the DermaPen, which is like a tattoo gun. So it's got the needle's vibrating very, very quickly across the skin. So it doesn't really cause much pain. It's more of a discomfort, almost like a little fly buzzing in your ear sort of thing. But it's not actually painful at all. And the second is what we call DermaFrac, which is a skin machine. Again, it's a roller on an electric rotator, and it sucks up the skin as it goes. So what that does is it actually infuses any sort of serums and stuff that we want to put in at the same time, but also pulls the skin away from any of the nerve endings or the vessels. So it's quite amazing actually. You end up with like a whole 10 mils worth of serum gone out of the chamber, and when you feel your face it's dry because it's needled it into the skin to where it's meant to go. But you pretty much look a little bit pink afterwards, but then you can go back and do your normal activities. So that's a no pain, no downtime. And that's great just for general skin rejuvenation. So stimulating collagen in the skin. As we get older, our skin thins out, whereas keeping the collagen going in the skin keeps it nice and thick and plump and elastic. And that means that it will lift better with your fillers, it will give you better results with your Botox, things like that. So it's a great treatment, and like I say, these days, people ask what are the side effects. There aren't really. With the pen, it is a little bit deeper than what the DermaFrac is. So if we're treating scar tissue or skin stretch marks and those sorts of things, then the pen tends to be better. And with the pen, you probably look red for about 12 hours. So you can have it done that afternoon and quite happily go back to work the next day without a problem. And you can put on makeup the next day as well. Aftercare is pretty simple. You just don't do anything to your skin that night. We usually put in a protective barrier over the top, and then you just leave it for the night. The good thing about skin needling is we can infuse in different serums. So when you're using skincare, obviously it's got to find its way down into the cells that it needs to get to. When we're doing needling, we actually put it in a lot deeper and put the skin care where we need it to go. So we use high concentrated serums in with the skin needling. So that might be to treat pigmentation, such as melasma. It may be to help with acne. We can infuse lactic acids and those sorts of things to help reduce acne. We don't like to treat overactive acne because big active acne, because then you can spread the bacteria, which we don't want to do. But we can definitely help stop new acne coming through if you are prone to it. We also can use vitamin C, rejuvenating serums to actually increase the amount of collagen that we're doing as well. So overall, it's a great treatment. It really helps the skin. You can use it anywhere, on the neck, the décolletage, the face, the hands. My hands actually need a treatment now, I think, after being in COVID for a while. But yes, it's a great treatment. Easy to do, and as I say, a lot better than it used to be. So we can treat scars, we can treat stretch marks, we can treat acne scars, we can treat pigmentation, we can treat fine lines, and definitely skin texture and pores. That's a big one that we often do. So I hope that's answered some of your questions. If you have any other questions you'd like to ask, feel free to post anything on our Facebook page, which is Jearn Cosmetic Medicine Ascot Vale. You can post it or email us any questions as well, or if you'd like to book in for a skin needling treatment, you can just go to our website www.wrinklesmelbourne.com. So I hope you've enjoyed this video, and we'll see you soon. Thanks, bye.